How many grafts will I need? I've had 2 hair transplants done already, but by the looks of these pics, how many grafts would I need to lower my hairline and fill in the lighter spots?
Thank you for your question. You submitted several photos and you are asking that how many grafts will you need to lower your hairline? And this is in the context of you having had 2 previous hair transplant surgeries. Now, this is a problem that we deal with a lot. I'm a cosmetic surgeon practicing in Manhattan and Long Island for over 20 years, and hair transplantation has been a large part of my practice for many years. Recently, we've actually transitioned to a different method of helping people with hair loss called hair regeneration, and we're seeing actually many more patients like yourself. You see, the question that you're asking certainly has an answer in terms of the number of grafts, but the problem is that you probably don't have enough grafts. When people have hair transplants, it's with the hope that the hair loss progression will be relatively slow, so you don't need another transplant anytime soon. Now, in your situation, you've already had 2. Now, what does that mean? It means that the donor area, the area where the hair never falls out, and when you think of the baldest man you've ever seen and has a narrow band of hair in the back, that hair is the true permanent zone. As a side note, the modern FUE procedures, whether they're done by hand, by robot, or with suction devices, still are FUEs, and unfortunately they have to go outside that donor zone in order to get the number of grafts that they intend to. So it puts the future hairs that, or hairs that were in the future going to thin out, those get transferred to another area of the scalp, which means that those hairs are actually at risk for thinning. The biggest challenge is stabilization. In our practice, what we have done is we've developed a technology called hair regeneration. And we're, like I said before, that we're seeing a lot more patients like yourself. There's a certain challenge and limitation because at a certain point, no matter how many times you want to go back for surgery, you just tap out, you run out of grafts. And so in a situation like yours, I would employ hair regeneration to help you understand more about this. Hair loss is not just about hair that is here today and not there tomorrow. It's a thinning process. In other words, hair growth cycles go through a progression called miniaturization. At a certain point, when the hair sheds out, the hair comes back thinner, and then sheds again, and it comes back thinner until it stops growing. What we're doing with hair regeneration is we're helping those hairs that are thinning change and become thicker hairs. This is not something we do on the surface, this is something we're doing under the skin. And the interesting thing also, of course, is it's non-surgical. It's actually an injection. What we're doing is we're using this stem cell-based wound healing technology that we originally used for assisting in hair transplant surgery to improve the survivability of the grafts and to improve the healing of the donor area when we would do a strip incision. What we have found is that thinner hairs became thicker. So what we developed over several years is a formulation and a method to help people stop their hair loss and thicken their existing viable hairs. So in your situation, we would first do the injection. We'd have, of course, a discussion and an assessment of what is available, but stabilization and very often with hair regeneration, people don't feel like they need a transplant. In fact, the majority of our patients, once they've done the treatments, and the treatments can be dramatic. In fact, we've observed that in the right candidate, this injection actually exceeds the results of 2 hair transplants. That is saying a lot. And so we've actually developed a method, and we're scaling this to help reach as many people as we can. So understanding that there is other options is hopefully gives you some reason for hope instead of trying to keep going back for the same procedure that you've had in the past. Another thing that unfortunately the reality is when you go back for more transplantation, you have considerably less hairs available for grafting because you're just tapping out this limited donor area. As far as the longevity of hair regeneration, we have approximately 5 years of data. We do a lot of these treatments a week. We have patients who come from all over the world, and so we follow our patients very closely. And we've certainly seen that it really is holding up very, very well. And what we have figured out is that if there's a point where there is some regression, another injection would be worthwhile doing. And so the way I see it, if someone like yourself needed to do an injection every 3 to 5 years to keep your hair, it's a lot more palatable, a lot less expensive, and a lot easier to do than doing transplants until you've run out of hair. So learn more about this technology and before you do another treatment. We're actually helping a lot of patients who have had surgery and then learn about this treatment and come to us during the early phase of their healing process to optimize the healing of those hair grafts as well as to maximize the benefit on for the thinning hairs. So hair regeneration has really been a significant new discovery, if you will, or a new step in helping people and filling the gap between pills and medications and surgery. So it's been quite successful for us, and we want to educate as many people as possible of this as an alternative for hair transplantation and helping people like yourself to stop your progression and hopefully thicken enough hairs so you don't feel the need to have another surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.